Naveen, a joint replacement surgeon practicing in the city of Mumbai. I have my clinic located in the suburb of Dadar by the name of HKS Clinic. I'm here to answer a few commonly asked questions in my practice. I hope to address them and clear the doubts. Most common question asked to me is, how long will my replaced knee last? And the answer to that is, basically the knee should last on an average for almost 15 to 20 years if done correctly, as well as if the patient takes good care of it. Uh, the most it also depends on the activities the patient has to undergo on his routinely basis. If he's a very active sportsman or something, it may not last as long. But still, with the advent of new metals and highly porcelain polys, we do see the knees may last much longer than they used to last a few years back. But we still expect the knees to last on an average to around 15 years at least. The next question people ask me is, how long will it take me to get back to my routine life? See, it's a major surgery. The body takes time to adapt to the new joint, so it does take a little time. Yes, with minimally invasive surgeries, it takes much shorter time than what it used to take previously. But I would say within a week's time, or within 5 to 7 days, most of the people are able to take a small round around their compound of their building. Within 20 days to a month's time, they're able to go to the market and come back. But to get completely comfortable with a new joint, most of the people take about 6 weeks to 12 weeks to get back to their routine life. Yes, there is a certain amount of pain which is incurred with the knee replacements. Is when the body is trying to adapt to the new joint, there is certain amount of reaction which is given by the joint. So what happens is, there's a bit of warmth around the knee, there is a bit of swelling around the knee. It causes some burning sensations around the knee, sometimes can cause some sleeplessness. These are all normal process of healing, and they all settle down over a period of time. And generally within 6 to 12 weeks, most of the patients are back to their routine activities. Another question which is commonly asked is, will I be able to sit down and use the Indian toilet after my knee replacement surgery? A very practical answer to that is, I would not generally advise my patients to do those activities on a routine basis, but doing them once in a while doesn't put the knee to that much of a harm. But if a person post knee replacement starts doing these activities day in and day out, the life of the knee can become much shorter. That is why it is not really advocated that a person does these activities day in and day out. Yes, once in a while it is fine. Patients also ask me, can I postpone my knee replacement with alternative methods, with a non-surgical methods of treatment? Yes, osteoarthritis is a debilitating disease, and it is a degenerative disease, meaning it happens with the age and the knee degenerating over a period of time. Yes, there are various methods where we attempt to try and protect the knee from a knee replacement by non-surgical methods early on. It's only when these fail we talk about a replacement surgery to give pain relief. When these fail to give pain relief, we talk about a knee replacement. Okay, so very common if a patient is in early arthritis, what we normally advocate is certain tonics for the knee, like collagen peptide granules, glucosamine, or physiotherapy helps a lot, because developing the muscles around the knee, developing the muscles around the hip, developing the muscles around the core of the core. These muscles are very, very important. If they are strong and they are balanced out, so they decrease the load on the knee, and this in the long run does tend to cause less degeneration around the knee. So it helps out. Another thing in early arthritis which we do is we sometimes inject the knee with certain gels which actually act like lubricants around the knee and helps the movements around the knee to be frictionless, and that helps also with causing less pain around the knee. These are a few methods which are usually tried on in early to moderate arthritis. It's only when these methods actually don't help the patient to get enough pain relief in their day-to-day activities, or they get stuck with their knees very frequently, we talk about a replacement surgery.